is Eduardo Alcaraz. I'm from Spain. I'm a physician and a pathologist. And I invented this phantom, which is now manufactured by Sorbonne. This simulator allows to perform a well-known procedure, non-invasive, but important diagnostic procedure, which is the fine needle aspiration procedure. We can obtain cells from a patient to diagnose diseases like cancer, for example. So it's quite important. So this model has several areas of interest: the thyroid, or even lymph node in the neck, axillary, which can allow you to mimic to create clinical scenarios of lymph nodes or even soft tissue tumors, breast for breast cancer lesions, and we have this as well in the. It can simulate some soft tissue tumors and in the parotid gland area, so salivary gland tumors or even any soft tissue or lymphoid neoplasms or process. This simulator, FioNA, allows us to learn almost everything, which is included in this procedure. So you can, there's some instructor with you always, who is going to act like an actor. So you can ask a few things about treatment, anticoagulant therapy. So then you have to ask to sign the informed consent form, and then you have to touch. But before to touch, you have to put your gloves on. So for the asepsis and antisepsis methodologies, it's not a strict aseptic method. It's not necessary. Just with gloves, then you have to palpate the lesion. We have to create a clinical scenario. So each student faces a different clinical scenario. So for example, this in the breast, this is a woman with a lump in the breast. So they have to touch, you can touch and you can feel that there is a lump. There is something which is not normal in this woman. So now they have to clean the area with an alcohol swab, is enough. You don't have to use Povidone, is enough with an alcohol swab. So you have to clean the surface. So now it's ready to perform the procedure. So now it's important to assemble the system. There are different methodologies, but the widely used is the aspiration one. So you need a holder like this. You assemble the syringe, and then you assemble the needle. 25 is enough, or 23, no more, because we don't use anesthesia. So this is enough. So with one hand you have to fix the lesion, and with another hand you perform the procedure. You insert the needle, you create vacuum, and then you release, and then you extract the needle, and now you use some swab to press to avoid hematomas. You can ask patient to press a little bit, or if you have an assistant, he can help you. So just a few seconds to obtain a sample. A sample which is going to be expelled onto the slides, and then students can perform the smear, and then they fix in alcohol or air dried. So there are different methodologies, different ways to perform the smear, depends of the school. perpendicularly or parallel. And then you even can rinse the needle for molecular purposes. So just a few seconds and we have obtained a pretty good sample of a patient which, who can have a disease like a cancer, infectious or inflammatory.